Sponsored by the Carpal RX. When you meet with your doctor and consider having carpal tunnel surgery, there are pros and cons to think about, because carpal tunnel surgery, like most surgeries, is not something to be taken lightly, because contrary to popular belief, there are significant risks involved, and the failure rate of surgery is considerable. Studies show that 52% of people are unsatisfied with their carpal tunnel surgery. In contrast, 91% of people who use non-surgical therapies are satisfied with their results. So what criteria do doctors use to determine if you need surgery? There actually are 3 specific criteria they use, which are tailored to a patient's specific needs. The first criterion is whether the patient has used all non-surgical methods to relieve their symptoms first. The first and most important of these are rest and avoidance. Has the patient rested their hand enough, and do they avoid the activity that caused the problems in the first place? If hand activities like typing are hurting your hand, you have to stay away from that activity so that your hands can heal. Splinting your hand, especially at night, is also important because that helps your hand rest. The other non-surgical treatment is therapeutic massage. Deep tissue therapeutic massage of the wrist and forearm is nearly 100% effective in relieving symptoms of carpal tunnel syndrome. When done properly and on a consistent basis, symptoms can disappear in as little as 2 weeks. The next criterion doctors use to determine if you need surgery is how severe your symptoms are. If your symptoms are mild to moderate and you can manage them well with splinting, rest, and massage, and perhaps taking some medicines to relieve the pain periodically, then surgery is not indicated. The final major criterion to determine if you need carpal tunnel surgery are your specific needs and your expectations. If your non-surgical treatments just have not worked, and you can accept the risks of surgery like infection and lost job time, then perhaps you will need surgery. Make sure you discuss with your doctor all surgical risks and benefits. And be sure your doctor is aware that you have tried all non-surgical treatments first. Remember, most patients are not satisfied with their surgery, whereas a great majority of patients are satisfied with their non-surgical therapy. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Remember, those non-surgical options that everyone should use first are resting your hand, splinting, especially at night, and deep tissue massage. But deep tissue massage must be performed every day and for 2 to 4 weeks. Having it done non-professionally or less often is not going to help you. And to get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms, and it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.